My name is Joy, and I'm happy to be here. Thank you to Acclaim Health for providing me this opportunity to deliver this quite interesting topic on bowel health and wellness to all of you today. Welcome, one and all. Um, the objectives for today is to describe the importance of bowel health and to differentiate the different kinds of fiber, what is prebiotics, probiotics, and what foods contain them, and recognizing common bowel concerns, identifying warning signs and symptoms when you should be approaching your doctor, and I will be explaining some safe approaches to managing constipation and some practical strategies which we can take away from this session. Um, Tracy will be launching a quick poll now, just to for me to understand what you think is should a normal, healthy bowel movement look like. So, how often do you think a healthy bowel movement should occur? Once a day, twice a day, or once in 3 days? Wow, very good. Very good. Wow, it keeps going. 80% of you have said. Great. But that was actually a trick question. All three answers are right. Um, for some people, it can be, for some people, it could be once in 3 days, and for some people, it could be thrice in a day. So everything is normal. So we're going to have a short description of what is inside our body when it comes to the digestive system. So as you can see in this image, it starts at the mouth, enters through the esophagus, and then goes into many hollow organs. The first one being the stomach, and then it goes into another hollow organ, which is your small intestine. Then it goes into your large intestine, and finally it gets out through your anus. So that is the first set of the anatomy when it comes to the digestive system. But then there are supporting digestive system elements, which is called the biliary tract. So the biliary tract comprises of your liver, gallbladder, pancreas. So all these actually produces enzymes which will flow into the hollow organs, mainly the small intestine. And these enzymes will actually help with the digestion. So the bile ducts, gallbladder, liver, and pancreas, they enter into the small intestine and they aid with the digestion of the food particles which is there inside. So the functions of the digestive system, as you all know, first of all, it digests, as the name suggests. It also absorbs the nutrients, absorbs water mainly, and formation of stool happens there. And it houses some beneficial bacteria, which we are going to talk about in great detail. It supports immune function and it also helps with the elimination. So the next thing which we are going to talk about is something called as gut-brain connection. So you have heard about, the gut feeling or butterflies in your stomach. What does that mean actually? Before your body actually, brain reacts to something, you already have like butterflies in your stomach when you get emotional. Or sometimes, when you are emotional, when you hear a bad news, we say, oh, my stomach is upset. I feel like throwing up. What happens is that your your digestive system has a brain of its own. So outside the actual brain, um, the number of nervous cells is the maximum in your small intestine and your large intestines. So that's why when you are hearing a happy news, you're already having butterflies in your stomach because your stomach is actually responding before even your brain is responding. And that's why when you're having, a not so pleasant situation, you feel like throwing up because again, the nervous system inside your gut is actually working. So this happens because of three main things. One is the enteric nervous system, which is a nervous system inside your gut. The other one is a vagus nerve. The vagus nerve actually starts all the way from the back of your spine. It's a spinal nerve. So it kind of like innervates into your stomach, into your small intestine, into your large intestine, and then also into your anus. So that also forms a part of this gut-brain connection. And the last but not the least is the gut microbiome. The gut microbiome is a lot of good bacteria resides inside our gut, and it is very, very vital that we need to maintain this gut microbiome, which I'm going to be talking about. But what this does is actually a lot of work. Um, the gut microbiome is responsible for a lot of autoimmune diseases. It keeps your bowel like really healthy, and it also helps with breaking down the fibers. Um, and these are a group of bacteria which we call anaerobic bacteria. That means they need very less oxygen to survive. This bacteria cannot live anywhere else. It is specific to being in the large intestine of your colon. And if they actually migrate a little bit up, say into your small intestine or into your stomach, they'll actually die because they cannot tolerate the acid which is being produced there. The other way they can actually get out is if the colon has like a micro puncture or something like that, it can escape through the wall of the colon and it can cause an infection elsewhere. So that's why we need to be really careful of where this microbiome actually lives. These helps with the digestive processes, but it is important, which we will talk later, on how to sustain this. So the role of the gut-brain connection is it causes a lot of things, good things. It gives you the hunger and the satiety feeling. It also influences what food preferences and cravings we have during each time. Like, in the morning, I'm craving coffee, and in the evening, I'm craving something else, might be chocolate, right? It also determines what foods we are sensitive to and what we are intolerant to. And our colon keeps on moving most of the time. So it also is responsible for the gut motility. Say something which you are not tolerating well gets into your colon, it immediately senses it and keeps moving your intestines faster so that the whatever intolerance or the food which it is not being tolerated by your body moves faster through your colon. It is also responsible for digestion and metabolism. It largely affects our mood and behavior without us even realizing that. It influences our stress level, it influences our pain sensitivity, our cognitive function, and immunity. We are going to talk about some common bowel health issues. The first one being irritable bowel syndrome. Can one of you come off mute and tell me what is irritable bowel syndrome? Anybody knows what it is? In short, it is called IBS.
It's basically your system not absorbing things, and you're constantly going from constipation to diarrhea, I believe.
Wonderful. Thanks, A or
Yeah.
Avi?
Yeah.
Yes,
yeah.
thank you. You're perfectly right. So it is a bowel condition, and people usually alternate between constipation and diarrhea, but there is also severe abdominal pain and bloating associated with it. So that is one thing. The next one is fecal incontinence. So it's the inability to control bowel movements, and it can lead to accidental leakage. It can be because of different reasons, because of muscle weakness. It could be because of chronic constipation. Sometimes aging also causes that because our muscles are not actually what they are supposed to be. And diarrhea, everybody knows what diarrhea is, but most people mistake it to having frequent stools. Frequent stools is not diarrhea unless it is watery, right? So you need to always take into consideration the consistency of the stool rather than the frequency of it. Common causes for diarrhea will include infection, especially when we are talking with older adults. We always have to be careful about some of the medication side effects because most medication either causes constipation or diarrhea. So if you are having diarrhea, might be think about what recent medication changes you have been having. There could be also food intolerance, as somebody mentioned, diarrhea and wheat issues. It also can be because of inflammatory bowel conditions. And the other common condition is constipation. And this is one of the most common GI complaints that I have been seeing. So this is, again, as I said, it is not going once in 3 days because it can be normal for some people. More of the consistency of the stool. So it could be a like hard pellet-like kind of like stool. There can be some severe straining. People might be feeling that they are not completely letting go, incomplete evacuation. And some of the risk factors could be because we are not having enough fiber in our diet, could be because of dehydration, could be because we are not moving as much as we should be. And there could be some medications which can be causing it. And also, as we age, our bowels are not moving at the same pace as they were moving when you are 16, right? So those are the common risk factors for constipation. There are two types of constipation mainly. One, we call it as primary constipation, which we will be talking about. But secondary constipation is, there are some conditions which can cause the constipation. Example, hypothyroidism, diabetes, like an advanced diabetes where your blood sugars are not in control, that can cause constipation. And sometimes diseases that affect the brain and blood vessels. For example, if if a patient has a stroke or dementia, those are diseases of the brain which can actually slow down those vagal nerve responses, which we spoke about earlier, and that can cause constipation. People who are depressed can be constipated, and the use of certain medications such as opioids and chemotherapy can cause secondary constipation, as well as irritable bowel syndrome, which is IBS, and some cases of Crohn's and ulcerative colitis can cause secondary constipation. Normally, Crohn's and ulcerative colitis causes diarrhea, but in some cases, it causes constipation. Coming on to the primary constipation, so the primary constipation don't actually have a pathophysiology associated with that. So one is normal transit constipation, in which your colon is moving at the normal pace, but it doesn't have enough material inside to actually push it out. So when you're not taking enough fiber, there might be very little stool inside. So even though our colon is working to pushing it out, there is not enough to come out. So that could be one reason. The other one is the slow transit constipation, where the colon itself is moving at a slower pace. It usually is because of some neurological condition, example, a stroke or a Parkinson's, and it can cause the colon itself to, have vacation day or something like that. Then the last one is the outlet constipation. That means it has almost reached your rectum, which is the last part of the colon, but then it cannot get outside. The stool is not able to go outside. So in this case, people will be straining, there will be delayed bowel movements, and there is excessive pain. And some people might have to manually dig out the stool. So that is known as outlet constipation. Risk factors for constipation include lifestyle factors, medical factors, medication related, related to opioids, anticholinergics. Some of you might be in iron supplements. All these can cause constipation. And also aging, not directly, but if your aging has caused you to have reduced mobility, or if you're on regular medication use, or if you have a chronic illness and you're not able to move as much because of that, that can cause constipation. Tracy will be launching the second poll, and you're going to tell me what foods do you think will help your gut the most? Wow, very good. Again, this was a trick question. I'm in a very tricky mood today. But because there are multiple good answers to this, okay? 100 people, 100% of you have answered, which is very good. Fruits and vegetables came first, so everybody knows what's good for you. Nobody selected my favorite, which is bacon and sausage, which is not actually good, even though it's my favorite. It's not good. Cheeseburgers are my next favorite, and nobody selected that either. That means you guys are eating better diet than me. And yogurt is very good. We'll talk about yogurt and its role a little later. Diet sodas are bad, and nobody selected it. So very good. And beans and lentils have a lot of fiber, and that is also very good. So you guys are doing great. I don't know why I'm teaching you all these things, but you're doing great. All right. So the role of fiber in bowel health. So you all, I'm sure 100% of you have heard about we need to eat more fiber. So what does this fiber do? So it is the part of plant, the body, we cannot actually fully digest any kind of fiber. So in that way, it actually helps to regulate our bowel movements. It actually feeds the beneficial gut bacteria, which we already spoke about, and it also helps with maintaining healthy cholesterol levels, and it regulates blood sugar, and it prevents constipation. So there are two kinds of fiber. One is a soluble fiber and insoluble fiber. Don't really worry about what kind of fiber you're taking, because both of them are very good. I will tell you what the difference is. So the food sources for soluble fibers are usually like any kind of like grain or like beans, including like chia seeds. We have apples and applesauce, bananas, berries, broccoli, carrots, avocado, sweet potato, psyllium, and fiber supplements. The soluble fiber, it helps both with constipation and diarrhea. So if you're a person suffering from irritable bowel syndrome, the soluble fiber would be very good for you. The insoluble fiber it produces a lot of roughage, which means things which our body cannot actually digest. So this can be very good for just constipation. So the flax seeds, wheat bran, nuts, seeds, cauliflower, green beans, things which you think that, I can't chew it fully. Those kind of things are actually insoluble fibers. Potatoes with skin, fruits and vegetables with skin, whole grains and brown rice, these have insoluble fiber in them. So the soluble fiber, It dissolves in water and forms a gel-like substance in the digestive tract, and it softens the stool. It helps regulate blood sugar. So if you're a diabetic and if you want your blood sugar to remain stable, your soluble fiber is very good for that. It also helps lower cholesterol and it supports the gut bacteria. The insoluble fiber does not dissolve in water. It adds bulk to the stool because of its nature, and it helps the food move through the digestive tract more efficiently. So it prevents constipation, improves bowel regularity, and it prevents diverticular disease, and it supports colon health. So now the next poll. Which food has more fiber? People can come off mute or put it in the chat. What do you think has more fiber? Apple or apple juice? Anybody? Apple. Wonderful. So apple, so when you're thinking about, craving for an apple, make the wise choice next time. Wonderful. Thank you. Karen and Carolyn. What about brown rice versus white rice? Brown.
Brown.
Very good, Maya and Carolyn. Wonderful. Brown. Everybody's voting for brown. And then the next one is whole wheat bread or white bread?
Whole wheat
Whole
bread.
wheat. Wonderful. So this is how we have to make wise choices when we are selecting our food. So the fiber recommendations for women is 25 grams per day, and men it is 30 to 38 grams per day. But most people consume less than half of the recommended amount. So tips for seniors is fiber can cause a lot of bloating. So your body needs to get accustomed to it, right? So increase your fiber gradually. Say you're eating 4 pieces of broccoli per day, increase it to 6 and then 8. That way, gradually increase it so that it doesn't actually cause bloating. And also, when you're increasing the fiber, you also have to increase the amount of water you're drinking. There are other beneficial effects of fiber. It lowers your cholesterol, which I already mentioned. So what it actually does is it actually absorbs fatty acids from your colon and actually excretes it instead of otherwise the body normally absorbs it. But if you have enough fiber in your diet, the fiber will actually hold on to that fatty acids and excrete it. It reduces inflammation. It lowers blood pressure. It controls blood sugar, which we already spoke about. It actually prevents cancer, whether you know it or not. So increasing the fiber in your diet prevents you from certain types of cancer, especially if you're a woman. It prevents you from having breast cancer. It also prevents a lot of autoimmune diseases. Alicia, you had a question?
I'm sorry. I was muttering to myself. Yeah, I don't really understand the connection between preventing the weight loss.
You don't understand the connection?
With helping with weight loss and
good.
Fiber.
Wonderful. Glad to hear.
Is it because you're full and so therefore you stop eating more?
Yes. As we spoke about, it largely affects your hunger and satiety, right? Like, so you're full before you're actually full, and the body has a lot. Your stomach is holding a lot, let me put that way. It also, yes. Remember, it forms a gel-like substance. So it makes it, even if you eat a little bit, it makes it fuller. So, right. Yeah, so that's how it helps you.
Thank you.
All right. The other dietary consideration which we have to think about is prebiotics and probiotics. Anybody has heard about this prebiotic and probiotics in the past? There is a lot of advertisements going on about this, right? So what these are is prebiotics. We spoke a whole lot about, there is good bacteria in our gut. So the prebiotics are actually food for the good bacteria. So the more we eat prebiotics, the more gut bacteria will actually grow, and it'll, keep our bodies healthy, free of cancer, free of, autoimmune diseases and stuff. So the prebiotics are very good. The probiotics, these are the good bacteria themselves. So say you got like a stomach bug and you're having diarrhea, the body's, lost all of its good bacteria from your gut. So at this time, we might have to replace it with some probiotics. So we are going to talk a little bit about that. So prebiotics are the types of fiber that feed the beneficial gut bacteria. So they are basically food for the probiotics. So it promotes the growth of good bacteria, it improves digestion, it enhances immune health. It also has some role with calcium absorptions. So examples of prebiotic food is garlic, onions, leeks, asparagus, bananas, and whole grains. So again, a lot of things which we have already discussed under our soluble and insoluble fibers. So these are very good for the growth of the good bacteria. Probiotics are actually live beneficial bacteria that support our gut health. They help maintain the healthy gut flora, they support with digestion, they strengthen our immune system, and they reduce harmful bacteria in our system. So some examples are yogurt with live cultures, kefir, sauerkraut, kimchi, miso, tempeh, and some probiotic supplements which are available in the market. We will be talking about that shortly, okay? So anything which is fermented actually has some good beneficial bacteria in them, which can actually stick to our gut. So when we talk about, when we have all these amazing products in our pharmacy aisles called probiotics, right? But there are some possible side effects which you should be aware of. The side effects might include some gas or bloating, some mild stomach discomfort. There could be some temporary digestive changes, and they usually improve as our body adjusts to the probiotics. But if you are an older adult, and if you have any of the following chronic illnesses, you should talk to your doctor before taking any kind of probiotic, because as I said, it is a live bacteria. So people with compromised immune system or a recent major surgery or a severe critical illness, people who have central venous catheters, so when they are having a dialysis on a regular basis, they put a big catheter in them. So if you're having a catheter like that, or in cases of severe pancreatitis, people should be avoiding probiotics because it can lead to infections in people who are immunocompromised. It can also interact with antibiotics. Sorry, I'm just reading the chat. What is a cross caution on the autoimmune system? Caution on the autoimmune system. If you're having a low immunity, it is going to, because these are live bacteria, it's going to affect you. Even though it is good bacteria, as I mentioned, it can actually leave your colon and go outside where it shouldn't be because your immune system is lower. So if it goes outside your colon, it can actually cause you infection elsewhere. Did you get it, Diane? Okay, thank you. Also use caution because they are live bacteria. It can actually interact with antibiotics, antifungals, and any immunosuppressant drugs. So if you are taking an antibiotic, it's usually recommended that you take your probiotic several hours later, so that it does not interact with each other. Not all probiotic products on the shelf in a pharmacy is the same. There is different quality based on the bacterial strain which they are using. So always discuss these supplements with your healthcare provider. And always first focus on food-based probiotics. Yogurt is a very good option for most of us. So choose options like yogurt or kefir if you are able to do that. If you're not able to do that, then talk to your healthcare provider about these supplements. The next one we are going to talk about is hydration. Um, Adequate fluid intake is needed to keep our stool soft and to support digestion. So the role of the colon, the large intestine, sorry, Diane has a chat. I cannot have dairy, so it's hard market for me. Yes, in that case, you need to talk to your healthcare provider on how to get those extra supplements. Coming back to hydration, the role of the large intestine is actually to absorb water from your intestine and put it back into our body. So imagine the stool being there, which is soft, but then it stays longer in your colon. Say you're having a bowel movement once in 3 days. It stays in the colon for a long period of time, and the colon keeps extracting water again and again from the same stool, right? In that case, the stool becomes very, very hard. So that's why it's important to actually have adequate nutrition, adequate hydration when we are talking about fiber. So the fiber will give you a good gel-like stool, but then because of the action of the colon, the water goes away. But it should be maintained at a consistency where it's easier to pass. If it's not easier to pass, then we are going to get constipated. So whenever you're increasing your fiber, make sure you're also increasing your fluid intake. Most adults require 1.5 liters to 2 liters of fluid per day if there are no contradictions. Say if you're having a heart condition and your doctor has told you not to drink fluids more than 1 liter, follow that instruction. This is for the general sense I'm talking, it's 1.5 to 2 liters. Or if you're having a renal condition, follow the instruction of your healthcare provider. The rule of thumb is to keep your urine mild yellow in color. So if you're seeing that your urine is too concentrated, then you need to talk to your healthcare provider about it. Sorry, then you need to increase your fluids if you have no fluid restriction. Is clear tea or any considered now has fluid intake? Yeah, fluid intake could be anything. It could be your coffee, your tea, it could be your, I don't know, I would never recommend like soda, but if you are anything which is considered fluid, like your broth, your soup, your anything which is liquidy is considered fluid. So everything added up should be at least 1.5 liters. And Diane, if you're not able to tolerate dairy, you can also try sauerkraut or something like that, any kind of like fermented stuff to increase that good bacteria before looking into, probiotics. The physical activity. The more you move, your intestines also move. So even moderate activity like walking, stretching, or light exercise can improve bowel function. Healthy bowel habits. Usually I recommend my patients to have a good breakfast, have a cup of coffee or something hot, even hot water would do, to actually stimulate your bowels. So after you finish your breakfast, it's good to actually go to the washroom and sit for like 5 minutes, even if you don't have the urge. That way, your body can actually get into a routine of having a regular bowel movement. But if you have a urge to defecate, you answer to that urge. Don't postpone it. Um, and allow sufficient time for a bowel movement. Don't be in a hurry. Maintaining proper toileting posture. So usually you see in the first picture, we all sit in the commode or, in your toilet like that at a 90-degree angle. But it is preferred if you're having trouble with like constipation, it is preferred that we sit at the 35-degree angle. So you can put like a small stool under your legs to actually get into that squatting position. So your legs should be kind of like a bow, so you can get into that squatting position. We also establish routine toileting times so that you can develop a routine. The next one is called ILU massage. This is for people who are having difficulty with constipation. This is something which you can do by yourself. You all have received a handout from Acclaim Health on how to do this. You can also Google it. There are many videos on YouTube, TikTok, everywhere on how to do this ILU massage. Ideally, you do this massage every morning after breakfast, and then you go sit in the washroom. And this will actually help you to develop a routine. The next one we are going to talk about in a very short period of time is laxative. Can you just show off hands, or you can put it in the chat? How many of you or your loved one are on regular laxatives? Oh, Diane, oh, one. Just one. Okay, that's very good. Looks like nobody's on laxatives. Everybody's keeping up with their fiber intake and walking and yes, iPhone. No. Very good. Senna, wonderful. Okay. So just, little bit about laxatives. I wouldn't go into much detail. When lifestyle changes are not enough, such as like diet, hydration, and activity, then we should go into laxatives. And it should be used with caution, especially in older adults. The first kind of laxative, which most of you might know about, is psyllium husk, right? They actually add bulk to stool, but they also absorb water and help the stool move through intestine. So when you're talking about psyllium, it's very, very important that you drink additional fluids. If you're drinking the same amount of fluids, you're going to be more constipated. So that's why you need to keep in mind when you're taking psyllium. It is the safest long-term option and it improves the stool consistency. But very, very important again to take with adequate fluids. The next one is osmotic laxatives. So osmotic laxatives actually draw water from your colon into the stool and it softens the stool. And that's how it stimulates the bowel movement. So some of the common ones which we use are called PEG, or it's called polyethylene glycol. It's the white stuff which is colorless. You put it inside your water and you drink. The lactulose is the really, really sweet stuff. And then we have magnesium hydroxide. So this is effective for chronic constipation, but the possible side effects are dehydration because it pulls water from your body and puts it inside your colon. So it can lead to dehydration and also it can cause electrolyte imbalance, especially if you're taking the magnesium hydroxide. Somebody asked about stool softener. So this one is useful when the stool is like already formed and it's just going to make it easier to pass. So example is docusate sodium. It's usually used for people to avoid straining, and usually after major surgery, we just give it so that they can have a softer bowel movement. And the last one is the stimulant laxative. So these actually, when I spoke about constipation, I actually talked about some slow transit constipation. That means when your intestines are moving slowly, these laxatives actually go and make your colon move a little faster. So they stimulate intestinal muscles to move colon through the stool. Example are well known, Senna or Senokot and the bisacodyl. They work, I wouldn't say quickly, but they work overnight. So usually if you take it during the night, you might have a good bowel movement in the morning. And they should not be used regularly without medical advice because they can cause dependence or bowel irritation. Questions in the chat. What about tea laxatives? Tea laxatives has natural caffeine in them. It's perfectly safe. But consult with your healthcare provider. In some cases, when you have a heart condition, and if you're taking too much tea laxatives, it might be harmful. But mostly it is safe. Do laxatives affect the liver? It affects the liver. It has beneficial effects on the liver. I don't know anything about bad effects. But if you have a specific liver condition, it's best to consult with your doctor. But in general, they have beneficial effects on the liver. In fact, for some liver condition, we actually give laxatives so that the toxins produced by the liver are actually washed away by the laxative. So I hope I answered your question. Wonderful. So when you use laxatives on a daily basis or a regular basis, lifestyle changes should be always your first line of treatment. So if you can manage with some, ILU massage or like some walking or developing a routine, that should be your first line of treatment. Always consult with your healthcare provider about the use of laxatives. Overuse can lead to dependency and electrolyte imbalance. And always talk to your healthcare provider about it. The next one, we are going to see when you should be talking to your doctor about any of the bowel health issues. So when you have blood in your stool, it could be either fresh blood or it could be like old blood. It can be sometimes your stool can be really black. That means there is blood coming into your digestive system at an early part. Like it could be mostly in your stomach. If there are like ulcers and it's bleeding, your stool will be black. So that is kind of like urgency. You need to talk to your doctor about it. If there is unexplained weight loss, if there is persistent constipation or diarrhea, when you're experiencing severe abdominal pain, or when there is persistent nausea and vomiting, if you're having difficulty swallowing, and if you're experiencing changes in your bowel habits that are sudden or unusual, talk to your doctor about it. Say you're having a regular bowel movement for the last 20 years and suddenly you're having diarrhea like every day, 7 times a day. Go talk to your doctor about it. It's something which has to be addressed. Feeling that the bowel does not completely empty also has to be addressed, and fatigue or weakness associated with bowel change has to be addressed. Okay. As you can see, this chart shows which different types of like stool, the texture, right? Like 1 is very hard, 2 is like lumpy, 3 is like sausage shaped with cracks, 4 is sausage shaped but smooth, 5 is blobs, 6 is mushy, and 7 is entirely liquid. What do you think is the normal one? Which type of stool represents a healthy stool. 4. 4. Ooh, everybody says 4. Wonderful. 3. Okay. That's actually very good. 3 and 4 are both right answers. So basically having a sausage-shaped stool with cracks or without cracks is basically good. The 1 and 2 are constipation. 4, 6, and 7 are diarrhea. So you've all answered well. All right. This is not an easy topic to discuss for most people, right? But we need to break the stigma over this because bowel health is often overlooked due to embarrassment. It's not a conversation where you have with your friend over some coffee. It's not a table conversation, but it's very important that we have these conversations with our fellow older adults or with our people at home, because it can help identify problems earlier and it can improve our comfort, and it also enhances overall health outcomes. So just so you know, my anniversary just came up, and my husband presented me with bidet. I thought it was like, whom am I going to tell about me getting a bidet for my birthday, for my anniversary? But things like that can actually start conversations about bowel health. So I thought it was a fun present for me. But it's important to break that stigma. Francine has asked about stool color. Very good question, Francine. You also need to watch what color our stool is. Usually it is yellow in color. Sometimes it's brown, depending on how much fiber we are eating. But if your stool is like pale, it needs to be addressed. Usually that means that there is too much fat in your stool. That means your liver is not working properly or something like that. So if it's too pale, you need to go to your doctor. If it is black, I've already mentioned, it indicates that there is a gastric ulcer, so you need to go see your doctor. If it is red, there is fresh bleeding, so it's from the lower part of your colon. So that also has to be addressed. It could be a polyp, it could be an ulcer in your lower part of the intestine. It could also be any kind of tumor. It could be a benign tumor or a cancerous tumor. So any kind of bleeding, any kind of red color to your stool, it needs to be addressed. Green stool is always most likely caused by iron in your stool. So if you're on an iron supplement, it could be green. That's all I could think of right now. But if there are any other colors, please put it in the chat and I will try my best to answer it. All right, back to our presentation. What is one change you will try to improve in response to bowel health? Put it in your chat. Put it in the chat. Through this presentation, what is one thing which you learned and which you are willing to change in your lifestyle? More fiber, sitting position, yeah. Regular time to sit, increase hydration, fiber, very good. In case anybody is wondering about the small stool, which I mentioned, it's called Squatty Potty and it is available on Amazon. If anybody wants to buy that. Or you can just use something, makeshift stool under your feet, up to you. Put a small step stool, that also works. Very good. Exercise more, drinking water, fiber. Very good. Key takeaways, which you've already mentioned. Dollar store has tools. Diane said that. Okay, thank you, Diane. Add one extra fiber-rich food every day. Drink one more glass of water. Take a short walk after meals. Include yogurt or fermented food in your meals. These are the key takeaways for today.